Hello friends, today we will study the anatomy and physiology of the conjunctiva. We have seen the anatomy of the lens, cornea, and today we will discuss about the anatomy of the conjunctiva. So conjunctiva is one of the most important appendages of the eye. So it plays very important role in the protection of the eyeball. So we'll today's lecture we will see the definition of the conjunctiva, its parts, its type of the conjunctiva, its layer, its blood supply, arterial blood supply, venous blood supply, and its nerve supply. So today we will discuss about the anatomy and physiology. First we will see the anatomy. So before studying the anatomy and physiology, for what purpose we are studying this topic? So we can correlate the structure of the conjunctiva with its functions and a clinical presentation in common clinical disorder. So patient comes to the OPD, so complaining about the discharge, redness. So we should able to analyze the condition, examine the condition, and give the proper treatment. So identifying the important anatomical landmarks of the conjunctiva are very important. Is it a palpebral conjunctiva? It is a bulbar conjunctiva. Where is the limbus? So these structure are the very important. So after studying the anatomy in detail, we are able to classify the disease. So the conjunctiva, its inflammation is known as a conjunctivitis. So there are many types of the conjunctivitis. After studying the anatomy, we are able to uh, classify or differentiate between the various condition of the conjunctiva. So identifying the common symptoms and signs of the conjunctival disease, like the degenerative disease, then inflammatory diseases, then membrane, pseudomembrane, all these condition of the conjunctiva are very important. So we will start with the definition of the conjunctiva. So while studying the anatomy of the eyeball, we have discussed about the definition. So we once again we will repeat. So the conjunctiva is highly vascular structure. It is a translucent and it covers the uh, eyeball anteriorly and eyelids posteriorly. So we can sum up the definition like the conjunctiva. Conjunct means to join. To the conjunctiva joins the structure means eyelids to with the eyeball. So the conjunctiva is highly vascular, transparent, translucent, thin membrane which covers the eyeball anteriorly and eyelids posteriorly. So this structure forms the cul-de-sac like structure, so called as a conjunctival sac, which opens in front, called as a palpebral fissure. So we'll discuss palpebral fissure in next slide. So in the diagram you are able to see the various structure of the eyes. So as we discussed the part of the conjunctiva. So conjunctiva is of generally three types, means the bulbar conjunctiva, the conjunctiva which covers the eyeball anteriorly, the conjunctival fornices where the palpebral conjunctiva and bulbar conjunctiva meets, and the third one is a palpebral conjunctiva, the conjunctiva which covers the eyeball. So there are also marginal and limbal parts of the conjunctiva and along with the plica semilunaris. So there are main two types of the conjunctiva, is palpebral conjunctiva and bulbar conjunctiva. Here the palpebral conjunctiva can be divided into three parts. The conjunctiva which at the eyelid margin is called as a marginal conjunctiva. The conjunctiva which is present at the tarsal plate called as a tarsal conjunctiva, and the conjunctiva which is present at the orbital region called as a orbital conjunctiva. Another one is called as a bulbar conjunctiva. It is a can be classified into two parts, main bulbar conjunctiva and another one is limbal conjunctiva. So palpebral, first we see the palpebral conjunctiva. The palpebral conjunctiva starts from the subtarsal sulcus 2 mm posterior edge of the lid margin. So if the lid margin is there, it starts from the 2 mm posterior edge. So it is a highly vascular and it is extremely thin and it is a strongly bound to the tarsal plate. So palpebral conjunctiva is a very strongly adherent to the main eyelid tissue. So in the another one is a bulbar conjunctiva. The bulbar conjunctiva covers the sclera anteriorly with beneath the structures are tenon capsule and episcleral tissue. It is a thin, translucent and loosely attached to the underlying tissue called as a tenon capsule or episcleral tissue. So it can be easily moved. So structure of the that conjunctiva, bulbar conjunctiva, can be easily moved. So these are the main two types of the conjunctiva. So where the conjunctiva, two conjunctiva meets called as a fornix, where the junction of the palpebral conjunctiva and bulbar conjunctiva forms the structure called as a fornix. So there are four fornixes in the each eye: superior fornix, inferior fornix, lateral fornix, and medial fornix. Here the medial fornix is a uh, slightly open, so we will not in detail medial fornix. So transition region between the palpebral and bulbar conjunctiva. These conjunctival fornixes are the meeting point of the two conjunctiva. So superior fornix is about 10 mm from the limbus. It is a 10 mm away from the limbus, while the inferior fornix is 8 mm away from the limbus. Here the limbus is a sclerocorneal junction. Means the fornix, the structure fornix is 8 mm away from the limbus. Lateral and fornix is 14 mm away from the limbus, and medial it is, as I have told, it is open. So ducts of lacrimal gland open into the lateral part of the superior fornix. So in the anatomy of the lacrimal apparatus, we have discussed about the path of the lacrimal structure. So there are lacrimal glands. So lacrimal glands open into the anterior fornix with the help of lacrimal ducts. These are the important structure of the fornixes. So conjunctiva is of three layers mainly. So one important layer is a epithelium. So it is a stratified columnar epithelium about the 2 to 5 cells. At the limbus, it changes into stratified squamous into non-keratinized epithelium. At a lid margin, non-keratinized stratified squamous epithelium changes into keratinized stratified squamous epithelium. Here the goblet cells are present, which secretes the mucus. These are the accessory lacrimal glands. So epithelium is one of the most important structure of the conjunctiva. Then another layer is a layer of adipose tissue. Adipose layer, this layer, adipose layer is rich in the lymphocytes. So the importance of the fighting mechanism, the adipose layer plays very important role. So third layer is a fibrous layer. Fibrous layer is a layer which fibrous layer is a layer which covers the, which is firmly adherent to the tarsal plate. So another one is called as a submucosa. It is a fine, delicate connective tissue, that is lymphocytes, also called as a adipose tissue. This is a denser fiber tissue rich in blood vessels, nerves, smooth muscles, and accessory lacrimal glands. Here are the papillae are the present. So nerve supply. Bulbar conjunctiva is supplied by long ciliary nerve, mesociliary nerve, ophthalmic division of the trigeminal nerve, and the sensory nerve supply is all throughout the cornea. The sympathetic branch provides the superior cervical sympathetic to the blood vessels. here we can see the nerves. The blood supply, arterial blood supply is a posterior conjunctival arteries derived from the arterial arcade of the leads, which is formed by the palpebral branch of nasal and lacrimal arteries of the leads, while the anterior conjunctival arteries derived from the anterior ciliary arteries, muscular branch of the ophthalmic artery and the rectus muscle. So venous drainage is in palpebral and ophthalmic veins. So here is a diagrammatic presentation of the blood vessels. So lymphatic drainage is lymph nodes are arranged in the superficial and deep plexus in the submucosa. Ultimately, as in the leads to the preauricular and submandibular lymph nodes. So the physiology of the conjunctiva. The conjunctiva is a smooth surface. It permits the proper movements of the eyelids with the help of tear film. This secretes mucin and aqueous components of the tear film. So tear film is of three layers: mucous layer, aqueous layer, and lipid layer. So mucous layer, which is important layer of the tear film, is uh, secreted by the uh, uh, conjunctiva. So it is a highly vascular structure, supplies nutrition to the peripheral cornea. Aqueous veins drains from the anterior chamber, maintains the IOP. So lymphoid tissues helps in the combating infection. So the basic secretion, and also there is important in the reflex secretion, plays very important role in the reflex secretion. We will discuss in the physiology of the lacrimal apparatus. So these are the main points of the conjunctiva anatomy physiology. So we sum up the lecture with this. The anatomy, first the definition. The conjunctiva means joining. The joining true structure means the palpebral conjunctiva and bulbar conjunctiva meets at a point called as a fornix. So these are the different types of the conjunctiva, and we have seen the layers of the conjunctiva: epithelium layers, adipose tissue, and fibrous tissue. So these are the important structure of the conjunctiva. Next lecture we will discuss the another structure of the eyeball. Thank you very much.